can
Okay,
hear now.
okay.
Okay.
I'm like, I don't know what's going on, but I can hear you, you can hear me, so that's all that matters.
We'll just have our conversation.
Yeah, okay, awesome. So I was just saying to everyone that you're a podiatrist, and I'm excited to have this conversation about the foot-brain connection. So I'm glad that now people can hear me say that.
Yes, yes. I am excited to talk about the nervous system because I know that this is something that your audience has an interest in, and then of course you have a deep appreciation for.
Yes, absolutely. So I guess before we get started, for those that don't know what a podiatrist is, you just want to kind of explain who you are and what you do?
Yeah, absolutely. So I'm going to add to that I am a functional podiatrist. So I look very, very different at the foot and the body. I'm also a human movement specialist. So I am very much into the integrated function of the foot. I actually like to look at the foot from a sensory perspective. I look at it as a gateway into the brain and into the nervous system. Of course, I appreciate traditional podiatry means such as the biomechanics and orthotics, and I was trained as a surgeon. But just for the context of this is that I want the listeners to appreciate that I take a very deep functional, fascial, sensory integrated based approach.
Yeah, and that's important for our conversation, I think,
Yeah.
as well. Because, yeah, you look at everything as the whole system, and then even the brain and how that connects with everything. So
Yeah.
that's cool. Well, for those that don't know me, if you're from Dr. Emily's page, I'm a physical therapist, a sports physical therapist, and actually, me and Emily both live in the same state, so we're just like down the road from each other.
Just by chance.
Yeah, just by chance. But okay, let's just dive into it. So we're
Awesome.
talking today about the foot-brain connection, and let's just start by kind of going through, if you can explain the concept. I have a whole list of questions. What does the foot-brain connection mean to you, and why is it important for overall neurological health?
Yes. So if we think about the foot, the only contact point between the body and the foot is the body and the ground, excuse me, is the foot, but it's more specifically the skin in the bottom of the foot. So it has very special nerves. They are called touch nerves, mechanoceptors, or these touch nerves that are actually designed to read and adjust to every step that we're taking. It's an important part of how we respond to the ground. We maintain balance. We understand impact forces. Impact forces stimulate the brain, muscles, bones, cells. A lot of the information of what feeds the brain is based off of touching and connecting to the ground.
Yeah, and that's huge. Yeah, I know that like the sensory input is huge and kind of wakes things up sometimes too, right?
It does, absolutely. If people think of like a baby learning to walk, right, and stand up, a lot of that like powerful sensory touch nerves from the bottom of the foot was used in that. Those same nerves are in our hands, so that's why I always will have people have things in their hands, right? Like from a therapy or a training perspective, is I always want to have the hands stimulated just as much as the feet.
Yeah, I think you actually came out with a new product recently,
Yeah.
right? The
Yes.
heating product. That's
Yep.
cool. Awesome. I know we're talking about the foot, so not to get off topic, but anyways, that's cool. So what role does proprioception play in that foot-brain connection now that we know we talked about the mechanoreceptors and how they work?
Yes. So proprioception, if the listeners are like, what? I thought that mechanoception. What is this? So proprioception is going to be around joints. So all of your joints is where we can think of the proprioceptors. When you are on like a wobble board or something that's unstable or your foot is wobbly, you are stimulating proprioceptors or joint receptors. And we have so many joints in our body. Think about our spine and all the joints. All of those proprioceptors feed to the brain to tell you where you are in space. That's really why this nervous system story is so important, because if I'm trying to stand or walk, I need to know where I am in the room, where my center of mass is, where my center of mass is in relation to the ground or my base. So proprioception joints strongly interplays with mechanoception touch, which is the feet and the hands.
Right. And so for people that have had neurological, problems or injuries, obviously those things can be altered, correct?
Absolutely. You can get a slowed feedback or awareness of the perception. So when you bring in a stimulus, you just don't feel it fast enough.
Right.
Anytime you're talking about the nervous system, right? Like, how do I stabilize? How do I feel my body? Where's the wobble? Everything is neurological. It's really based off of timing. So how fast do you feel your feet? How fast do you feel the ankle, right? Think if you're about to step off of a curb, like a sidewalk, and you misstep. I'm sure we've all done this, and you're like, bloop, right? And you're like, woo, caught myself, right? So you want like a fast reaction time.
Yeah.
That reaction time is directly related to the rate at which your brain can feel the right? So it's a timing game. And this, as we get older or as we have a neurological injury, that perception just slows. And that's where falls and injuries happen.
Yeah, and that's kind of where, I mean, in Logan, my husband's recovery, they've been using like different things to stimulate him to help with some of
Mhm.
that proprioceptive feedback. So do you want to talk about, I guess this would be a good time to talk about some of the products that you actually gave my husband to help with that stimulation as well, and how like what, the science is behind that.
Yeah. So there's many different ones. I'll mention mine last, so that's not biased in that direction. But another one that I really, really like, aside of the texture, is vibration. So you could use vibration-based tools around a joint, the bottom of the foot, all the different muscles using like a vibration platform, things like that. That's very nerve stimulating. You could do things like kinesiology tape. That's going to wake up proprioceptors as well, so your brain feels or sees the joint.
Mm-hmm.
I love things like dry brushing. You could use like wrist weights, weighted vests, weighted apparel. All of that is waking up the brain so you can feel where you are in space. And then the other one, which is Naboso, is texture. And texture is very specific to the hands and to the feet, similar to vibration. Vibration is very specific to the hands and the feet, but also the joints. And then the textures waking up a very specific nerve in the bottom of the feet. This is actually a patented texture, and this is like braille. So the little, if you put your fingers, it'll actually make an indent, kind of like braille dots. There's a very specific stimulus that Naboso creates. Similar, when you are on a vibration platform, there's a very specific frequency to the waves to stimulate the nervous system. The more specific you can be to the brain, the better the results.
So would you recommend for somebody that has like a neurological injury to kind of like try all the different, methods out and see what works best for them?
Absolutely, 100%, because there's different nerves. So the nerve that senses vibration is different than the nerve that senses texture, which is different than the nerve that senses temperature and pain and stretch and pressure, right? We need to make sure that we're waking up all of those.
Okay.
Yeah.
Awesome. I had a lot of people send in messages yesterday about foot drop. So
Okay.
for somebody that maybe has like foot drop, what texture do you think would be like the most beneficial? Let's stick with the stroke scenario. Would you think that that would help somebody that has a stroke to use like which one, vibration, the texture, or something else?
Yeah. So I actually use all of them. And so I do see foot drop a lot in my office
Mhm.
for various reasons, whatever it could be. Now, what's important is that the person that's experiencing the foot drop, one, we need to understand that the sensory stimulation, the goal right now is not to reverse the foot drop. So we don't want people to think, oh, it's going to suddenly give me this capacity to lift the foot, right? Especially depending on how long you've had the foot drop. If you've had it for several years, 10 years, right now, the duration of time of exposure to your nervous system makes it harder.
Right.
But can we wake up the nerves? As an example, I just saw a patient a couple weeks ago that had kind of the early symptoms of a foot drop. And I told her, I want you to use the NeuroStick on the front of the leg, so the anterior compartment, that's the muscles that lifts the
Yeah.
foot up, right? So we're going to wake them up.
Mhm.
We're going to use a vibration. So we're kind of doing this dual sensory to wake up the muscles. Then we're going to do some isometric contractions to like really dial in the motor activation. Then to the bottom of the foot is we will bring in the texture through the Naboso socks or through the insoles or something. So every time the foot contacts the ground, they can feel it a little bit faster. They can just try to stay as more connected to their foundation despite having the foot drop. So we have to kind of approach it both
Yeah.
ways.
And then like you probably do like an integrative approach after that, right? So you integrate all those things into functional movements and all that
Yep.
stuff.
100%,
Yeah.
100%. And I am a big believer in AFOs. So some people will resist them, and I completely
Hmm.
understand where they're coming from on them. But I always look at foot drop and the compensation pattern. Like, what are you
Yeah.
doing to change the way that you're walking, to pick up the leg? What transfer stress elsewhere in the body is that causing? I
Yeah.
think that the benefit of the AFO supersedes the stress you're causing to the rest of the system.
I completely agree. And I agree also about the people being resistant to trying AFOs because of like just how, I guess, how it looks or, you know, what other people's perspective or perception is of them. My
Yep.
husband has gone through, I think, 4 or 5 different AFOs at this point. And it's funny that you mentioned that because today we just got our BioNest. I don't know if you've heard of the BioNest unit
Yep.
that does the electrical stimulation. So it just came in. So now he has a different sort of like device that helps assist in the foot drop that provides that like that different sort of cue or stimulus
Yep.
to get his foot to lift up. So that's
Yep.
crazy.
Yep.
Okay, so next question. How would individuals assess their foot health at home?
So I would say it could be based off of your foot posture.
Hmm.
So I teach people how to find neutral. I actually like people to feel the rotations of the foot, feel how every time you roll to the outside, the inside of the feet, your leg is actually rotating in and out. Just my foot is interconnected. Okay, what does that feel like? Okay, so if I rotate my hips, I can actually lift my arch, right? So that's something that's very important. So I call that setting your base. So when you stand, if you have a standing desk, if you're doing dishes, brushing your teeth, whatever it is, can you find this nice stable foot posture? And then how that translates to the rest of your body. Then I like to activate the foot and get the toe flexors activated. Your toes play a very, very important role in balance. So, from a neurological perspective, where balance is one of our focuses, toe strength is critical to reducing falls and maintaining balance.
Hmm.
So, what is our toe alignment? What's our toe position? Do we need to use toe spacers to try to support long, straight, flat digits? And then, of course, if you have pain anywhere, we can kind of address some of that. But really thinking of your base of support, keep it active, keep it stimulated, keep it aware, and then what is happening into your digits.
Awesome. And then when should somebody see a podiatrist? Like when is it important to actually get something checked out? Like if they have a little bit of like a bunion or something like that, is that important to go get corrected right away, or should they, you know, wait and try some exercises instead?
I actually love the patient that comes preventatively to me
Yeah, me
and
too.
just wants a healthy foot screen,
Oh
right?
yeah.
That's not a lot of people. That's so not a lot of people. But going in and saying like, hey, this is my foot type. My parent or a loved one had like a crazy bunion or awful XYZ, right? And I just don't want to go through that. I love hiking. I want to be able to do this as long as possible,
Hmm.
right? And they're thinking about it as kind of this very much preventive. That's one.
Yeah.
The other one could be is if you've had persistent symptoms of whatever it is and it's not resolving. Of course, actually, with the way that physical therapy is set up now, they could go to a physical therapist as well because there's open access. So they could do
Hmm.
that. But I think seeing a qualified provider who's going to look at it in the functional integrated way, which of course I know that you do, and it's a little bit more the philosophy of physical therapy versus traditional podiatry. So I actually encourage them to go more to physical therapy. But there's a lot of resources online. I'm very much of an advocate of people taking ownership of their own health so they could explore their own body and ask questions. But obviously, pain is one of the biggest indicators.
Yeah, yeah, for sure. Yeah. I see a lot of people like proactively at this point, but I remember when I was younger in my career, it was definitely like always when something had gone wrong that they would finally come to me and I'm like, oh, well, you know, when did this start to hurt? Oh, like 10 years ago it started to act up. And I was like, oh, I wish you would have came to me 10 years ago because you don't realize how much that affects everything up the chain and how it changes you and
Yeah.
your movement patterns over time. And then there's that pain aspect too, if you've been, you know, developing pain for so long. So that would be my next question for you is that the pain portion of this. So like someone that maybe has had chronic pain for a long time, how
Mhm.
does that like alter, you know, like the proprioceptive feedback and all of that stuff at the foot level? Like what would you give to someone that's had chronic pain in their feet, and even with like orthotics or devices, they're still having that pain?
Yeah, so I would say depends on what the condition
Mhm.
is, right? One thing that I do want to mention that maybe people don't realize is that if you have, let's say, chronic plantar heel pain, whatever it is, and it's actually not plantar fasciitis, it might be what's called a Baxter's nerve entrapment. It's a nerve that's just stuck down, right? Is if it is chronically stuck down in the fascia, you can not only have persistent pain, but you can actually get atrophy of the muscles in the feet, and you get what's called denervation. And you can see that on MRIs. They will say denervation of the intrinsics on the outside of the foot. I won't share the names because it's too much, but kind of along here, they could say denervation and atrophy of blah, blah, blah muscle,
Yeah.
right? So you can see that now you're dealing with a loss of the intrinsic deep muscles that stabilize the foot. Well, now that's going to lead to other stress levels. So we want to try to make sure that we're not ignoring certain things that could lead to chronic changes in muscle strength. I do use orthotics, not all the time, but it is something that I will recommend. And sometimes, depending on the foot type and the way that they're presenting, there's a specific type of a flat foot called a ligament lax foot. And this is an important exception to the foot rules that actually benefits from orthotics. So that is one where it's not a matter of loss of muscle strength. It's actually the ligaments are too stretchy that it can't maintain the proper foot posture, and they just kind of bottom out and that arch drops down, which then causes transfer stress to the knees, hips, lower back, all the way
Right.
up.
Right. And so people that have like hypermobility and Ehlers-Danlos syndrome, people would probably fall into that category, right?
Yep, exactly.
Okay. Yeah, we have a lot of, I mean, gymnasts obviously have a lot of that too,
Mhm.
but they tend to have strong feet, a strong baseline. But I do get a lot of patients that have that like chronically flat foot stuff. And
Yeah.
when it comes to orthotics, do you always recommend orthotics for people that have foot problems, or when is an orthotic not an appropriate device to use?
So I may, for a temporary period, put them in arch supports to try to get control of the situation. I actually call that putting out the fire,
Yeah.
where I am putting them in a very strict protocol that does require
Mhm.
support, right? Then, and honestly, if I'm doing it for a short period, I'm not going to charge the patient $500 for orthotics. Just use something over the counter. You don't need to get custom for that. Typically, when it starts to go into like this laxity or a post-tib tendinosis with a tear, right? So now we're chronic, right?
Mhm.
I typically will demonstrate it through imaging that, okay, this is a chronic change in the tissue, whether it's a tendon, a ligament, whatever, that is making it very difficult to control the mechanics of the foot. You are going to continue to get persistent pain or transfer stress. Let's look at the orthotic.
Yeah.
But I always give exercises at the same time. So they're never given, here's your orthotic, have a nice life. Like
Yeah.
they're,
Yeah.
yeah,
Yeah.
exactly. Right. I've never done that once in my, like, never, not going to do that again. Right. Done that once as far as like, here's your magic insert. That is all you need, all your problems go away. Right.
Yeah.
You always want to do, still you're doing your foot releasing, you're still strengthening your foot muscles, your core muscles, your hip muscles. Maybe you use a custom orthotic, but you're still doing this over here.
Yeah. I think that it's so important that you said that too, because even like, some patients that like they've been in orthotics for so long, they were never giving exercises or told that they need to also strengthen, right?
Yeah.
It's not a long-term solution for everybody. Really, most of the time it should be, especially if it's maybe an acute injury, it should be more short-term and then with the goal in mind of getting out of them at some point. But I see a lot of patients, I don't know about you, that have been in them for years and they like never walk around without orthotics in their shoes.
Yes.
Yeah.
Yeah. And some of the orthotics could be just activity specific.
Right.
So maybe you only use custom orthotics when you stand on your feet for 10 hours a day as a nurse. I don't know, right? Just as an example. But then the rest of the day, let's have your feet awake, active, and part of this. I call it a posture party. Like your feet are part of the posture
Love that.
party, right? They have to stay engaged.
Yeah,
Yeah.
that's awesome. Okay, let's get back, I guess, to neurological questions. What kind of footwear would you recommend someone that has a neurological disorder or some sort of dysfunction?
So that one is is a little bit hard to answer. So as someone has a neurological condition, and let's say they have a neurological foot, there is going to be this predisposition for your foot to do this, right? And it's, I can't even do it, it's
Claw.
more like that,
Claw.
like this, where it is a super cavus foot. Actually, in the space of feet, clinical feet, it is called a neurological
Yes.
foot, and it is just superly supinated and cavus, right? And all the digits come up. That is a very, very stiff, painful,
Yeah.
unflexible, locked
My
foot.
husband has that right now.
He does. Okay. So you have to look at more of a cushioned environment. I mean, you have to. That foot can't unlock to take then the impact forces and the load when we move. So if we are going into a more cushioned, comfortable area, you are damping the important sensory information. That is where I would look at the Naboso insoles and add in either the socks or the insoles, something with the sensory texture to say, okay, I get that this shoe, which I need because of my presentation, is sensorily disconnecting me. How do I offset that so that my brain still stays connected to this limb? That's how I would be looking at that.
Yeah, that's really good point. Yeah, I think that he feels more comfortable in flat shoes that have like no support really. But I think it's just because he feels like he's going to roll his ankle every step of the way when he doesn't have
Yes.
something completely flat.
Yes.
But he loves
Yes.
wearing those texture socks. So if anyone's listening, if you're hesitant about her socks, the Naboso socks, the texture ones, my husband loves them. I love them. We all love them. So definitely get a pair of those.
Thank
What
you.
about people for neuropathy? For those people that have a hard time kind of like feeling things and just, have that neuropathy type pain, what would you suggest for them?
Similar. So I am not a believer in putting someone with neuropathy in a
Yeah.
bubble, meaning they live in a bubble. Um, I think that we need to get them still barefoot,
Hmm.
still sensorily stimulated, obviously be smart, clean the area, check the foot before and after, be in a controlled environment, be aware that it is going to increase your sway, so your instability, just because you cannot connect to the foot. But the way that neuroplasticity works, you have to challenge the nervous system to drive the changes in the adaptation to sensory stimulation. And although people are neuropathic and they have lack of sensation, it's not all sensory stimulation. And that's what's really interesting. We've had people who say, I haven't felt my feet in 10 years. They use our insoles or our socks and they're like, oh my gosh, I have not felt my feet in 10 years. To me, that is the best example that not every nerve is
Damage.
sensation or the feedback or the pathway, right? Typically, the ones that are first affected are the free nerves. So these are nociceptors and thermoceptors. So those are the ones that are sensitive to pain and temperature.
Hmm.
So just kind of knowing that they may not feel if they step on like a tack, right? Something sharp, but they might still feel vibration. They might still feel texture. So we want to make sure that we're still bringing in that stimulation. And then, of course, smart footwear. I'm very much into, which I know you would appreciate, is the global. How do you globally control balance, right? It's not just at your feet, it's also your center of mass. Next in line of highly proprioceptive rich is your thoracolumbar fascia. So if you can tap into the core and the spider web of fascia and muscles that surround your center of gravity, then you have increased postural awareness.
That's awesome. Yeah, I feel like hopefully that's beneficial for people to hear. But yeah, a lot of people have neuropathy, chronic neuropathy, or even like post-surgical neuropathy. I found, and I do think that there's a lot of things like stimulus can really be effective for people that have neuropathy to desensitize that issue as
Mhm.
well, right? And to like wake things up. I experienced that when I was post Achilles rupture. My foot felt like I just had this like disconnect with the ground. And when I did start, using my toe spacers again and using like the textured toe socks, I did feel like I could actually finally connect and wake things up. And I felt like it helped my recovery substantially.
Yeah, yeah, absolutely. What I didn't mention, what most people think about with neuropathies is numbness,
Hmm.
but kind of what you were referencing a little bit is what's called allodynia. So you can have a heightened pain sensitivity. So something that should not be painful is painful to you. How you can use these different products and methods is you're actually desensitizing. So if you bring a stimulus, think of it almost like distracting the brain, right? That if I like tap over here, then I don't focus or notice that. It's a little bit about what you're trying to do.
Awesome. I know that we only have like 30 minutes, but how about let's wrap it up with what advice would you have for individuals who may be experiencing like maybe balance issues or coordination difficulties due to foot related problems?
Yeah, so of course there's the sensory awareness, right? What can you do to turn up the volume to the stimulus of the feet? Just what could you do to make you feel your feet more? If you have neuropathies, foot drops, different things like that, what can you do? Use a vibration platform, use Naboso, take off your shoes and socks, go on surfaces that are harder, like a hardwood floor will always be more neurologically stimulating than carpet or yoga mats and things like that, right? And then how do you get your foot to be a better balancing mechanism? Well, one, you have to set your base. So what is that? I shared a little bit, but it's finding neutral, find your tripod, spread your toes. Third would be tapping into your digits. Are they long, straight, and flat? Do you have bunions and hammer toes? If you do, you really need to look at toe spacers
Mm-hmm.
to get your toes aligned because they're part of the balance formula, right? Then you have to get them strong as an anchor. I call it gripping the ground. You want to actually like grip the ground, kind of like a gecko grips the ground, and your gripping of the ground or your anchoring response, call it what you want, has to connect to your pelvic floor and to your diaphragm. So you have to get your base to connect to your center of mass. And even though you might not feel this because you have neuropathies, you can't connect to it really, it's still happening. These fascial lines are still happening. You're still waking up the way your feet connect to your pelvic floor and to your deep core stabilizers. And then that translates into everything else. And then I add on like vision and vestibular and everything. Oh, and then don't forget your hands. Stimulate your hands. That'll
But
wake up the brain too.
do you think that like by like stimulating the feet and kind of focusing on the feet, it also can correct other problems without ever like really focusing on those other areas?
What do you mean?
Just like, so if you were to like stimulate and wake up the nerves of the feet, do you think that that would translate to maybe waking up nerves in other parts of your body? Or do you think that you would still need like exercises or input into those different nerves? Because I just feel like the feet are so critical, right? They like also transfer up. So sometimes you can like start feeling better even in areas that are more proximal to that region.
Oh, yeah.
So I didn't know if you've had any like success stories with just like waking up the feet. Now all of a sudden they like can maybe move their arm better or like do other things a little bit easier.
I mean, if you follow fascia lines, then absolutely, right? Is you're saying like, okay, if these muscles, and really it would be the foot connecting to the core,
Yeah.
that's a fascial line, which then the core connects and radiates out to other lines, which then could go to hand, shoulder, neck, balance, hip, back, right? So
Yeah.
everything. Um, I truly believe that tapping into your feet and your foundation is as critical a component of your movement story as breathing, right? And I teach a lot in like therapists and fitness and strength coaches, and it becomes more of a philosophy of movement or philosophy of rehab in a sense of just if you are going to do an exercise, this is for all the listeners, if you're going to do an exercise, just what is the stimulus to the feet? Do you have shoes on? Do you not? What's the surface that you're standing on? Are you activating the toes? Are the toes spread? Or are you on your tripod? Like it's inherent to literally
Yeah.
every exercise you do. Just like,
Connect.
oh, am I going to exhale when I do a bicep curl? Yes, your breath is integrated into every exercise.
Yeah. Yeah. Most people don't really realize what their feet are doing at any given second too. So, having that mind body connection of where is my foot in space and what's going on? Do I have my tripod? Am I like, is my posture good? I think that that's critical too. So, I guess we can end there. I know that you're like wrapped for time, but do you have like a closing maybe foot health routine for anybody that has maybe a neurological impairment that you would recommend?
Yeah, so this isn't just for people with a neurological impairment. So just in case the listeners, your loved one has it, this is for you too, is I'm a huge believer in releasing the feet every day. This is, I would recommend with the neuro ball, partly just because it splits into two pieces. So you can do both feet at the same time, get the texture to wake up the nerves, hold it 20 seconds, different points on the foot. So you're getting pinpoint pressure release.
Mm-hmm.
Do it when you brush your teeth, easy, easy. Second one would be actually finding your stable base. So I just want everyone to do called a posture check. And this would be release your feet, then literally stand there with your feet shoulder width apart. find your foot tripod, lift your toes, spread them out wide, right? Little rotation to the hip. Then do what's called a forward lean, where you stand nice and tall and you would
Mhm.
just ever so slightly lean your body forward, just slightly. And then you
Mhm.
come back. Every time you lean forward, your toes are going to push into the ground. So you're activating. Can you do that activation without leaning? So you literally just stand there on your tripod, activate your toes. Awesome. Can you now activate your toes, shift your weight, and stand on one leg for 10 seconds? And then come back down. Do that on the other side. Do it 3 times on each side. So now we've essentially woken up the nerves. We released the foot, stimulated the circulation, found a proper foot posture, connected to it, and then we woke up the muscles that stabilize your feet. That would be my little routine, and it takes 5 minutes.
Yeah.
You can literally do that whole thing in 5 minutes.
And that's your morning routine, or do you do
That
it
would be
morning
my,
and evening?
honestly, if you have balance issues, you have a neurological, I would do it both.
Okay. That's
Yeah.
fair. That's fair.
And before you do your workout. So if you're going to go do a workout, I would do it before a workout also.
Awesome. Well, I think this
Yeah.
has been really helpful. Hopefully, people got a lot of good information from this. If people want to find you, obviously you have a couple different Instagram handles, but where should they find you and send you messages?
Yeah, so they could definitely do the Dr. Emily DPM. That's a long story. I was hacked. Then, then I got the account back. You know what I mean?
Yeah,
Like all
yeah.
those fun hackers. Anyway, but that is one. I do see patients virtually, so that is important. My website, the easiest URL is thefunctionalfootdoc.com. That's for my podiatry. And then just go to YouTube, and if you search YouTube Dr. Emily Feet, you will find hundreds of videos on there. And then I know we've created some content together. We're looking to do more
Mhm.
stuff. So I think that people can just kind of just know we'll be dancing around together again.
Awesome. All right. Well, Emily, have a good rest of your day. Hopefully, if anyone has any questions, we will be probably posting this later, and you guys can kind of ask questions there, and we'll kind of follow up on those.
Awesome.
All right. Have a good rest of your day. Thank you so much. Bye.